Now, structuring and raising capital for investments in healthcare, that will be one of the things under discussion at the Executive Investment Conference organized by the Wharton Club of Africa in Lagos in about 2 weeks' time. All right, at the heart of this discussion is a very simple question. Who should pay for healthcare services? Now, the answer in Kenya's case is to scale up mandatory premiums from the 1st of April for the National Medical Insurance Fund. Even then, however, it really won't change insurance penetration rates in East Africa's biggest economy. At the moment, they're about 4%. As Dr. Felix Olale, chairman of the Excelsior Group, told me, the flip side of this financing and service provision challenge is that there's quite a bit of room for private sector investments in healthcare.
Public sector indigent primary care population is a role of government.
Yeah.
Middle class, who have ability to pay, we believe is a role of private sector largely. Now, there's no reason why, in some cases, we can't serve them through a good, well-functioning public system. And then the ones who are really at the top often tend to have employment, they have insurance, so they're not suffering as much from a financing challenge compared to the other segments. So really this is about taking a business view or an enterprise view within healthcare, much like you would do with infrastructure, much like you would do with power, to really then build an ecosystem that can thrive and drive economic growth.
And this is the sweet spot that you focus on, that middle class unmet need for clinical services across sub-Saharan Africa. What markets excite you the most in sub-Saharan Africa and why?
I think there are three sectors which again have these underlying dynamics that I just described. One is diagnostics. So if you have money and you have access to a hospital, this is in Kenya, Nairobi, you still have a chance of 36% that your diagnosis will be wrong. And so the issue becomes, well, how do we actually offer this fundamental service that then allows a doctor to be able to make a decision, allows the healthcare system to function properly, reduces inefficiencies, right? And, by the way, is one of the most profitable sectors you'll ever be able to invest in, 35% margins. So diagnostics is one we're very excited about. I like medical education. I think medical education, if you look at the number of doctors we need, the number of healthcare workers we need to serve this demand, again, woefully underserved, big opportunity, profitable business. And
of course, at the same time, there's also a dearth, a lack of that talent coming into the market.
Precisely. And we did one thing, Rama, when I came back home to Kenya in 2011, I worked with Strathmore Business School along with a professor called Professor Steve Samlet at Wharton to set up an MBA in healthcare management program at Strathmore. And we're graduating 25 students from that program this year. So on the leaders-manager side, we're starting to solve that problem.
Because that now also bridges a gap, essentially creating 25 more of you.
Well, hopefully. That's the goal.
People with a medical training, but also an understanding of the business side.
Absolutely.
Let's go back to a statistic that you put out there. 36% chance of getting your diagnostics wrong.
Yes.
If that's being done in Kenya. How did you arrive at that figure? What contributes?
These are actually statistics that we take out of the public sector hospitals, where you look at a lab that is misread. You look at a misdiagnosis in terms of the clinical history of the patient. You look at people who then may even have the right diagnosis, but who are treated with the wrong medication because A, either the machine was not working, or B, the medication was not particularly the right one. So there's a lot of flaws within the system that then become an opportunity to set up adequate diagnostics. And if you recall, this is actually a high-margin business. So as a private sector investor, I would love to be able to build imaging centers, which we are doing. I'd love to be able to build labs, which we're doing, and do it at the right level of quality, because that is a profitable, high-return business for an investor to invest in.
And later on tomorrow, we'll be looking at investment flow.